Morning all, Keith Lewis from Balanced Body Mind here at SHP on a lovely Dubai morning. Today I'm going to talk briefly about the role of the transversus abdominis and why drawing your belly button in towards the spine is probably going to be causing you more pain and more instability in the long run. A lot of people took the research of a number of researchers, Richardson, Hodgson, Hydes, and this particular book, and there was other researchers by Paul Hodges and Mark Comerford and the role of the transversus. And a lot of people misinterpreted the data from these. And just because the transversus wasn't firing when there was pain, and we found that particular dysfunction, a lot of people interpreted that we should be training the transversus abdominis. True, the transversus is involved in lumbopelvic stabilisation, but it's probably secondary to the amount of work that's actually conducted by the diaphragm, for example. So when the diaphragm is used in lumbopelvic stabilisation, in concert with the transversus abdominis and the pelvic floor, we get a much better application of intra-abdominal pressure and stabilising mechanisms. A really easy way to interpret this and see what the transversus does in isolation, if we just hollow the abdomen and draw the belly button in towards the spine and try to take a nice deep breath, you'll notice that it's really hard because there's nowhere for the abdominal viscera to go. So we start to use the accessory muscles, the scalenes, the sternocleidomastoid and the pec minor. And this can create an inverted breathing pattern. We see this pattern as well with people who sit at desks for long periods of time and over-exercising as well. So walking around drawing your belly button in all the time is not going to make you any more stable in the long run. It might give you a full sense of stability, but try using your diaphragm, take a big deep breath in and push your belly away from the spine. Use it with the co-contraction with the TVA and the pelvic floor, and you'll probably find that this over a longer period of time is going to keep you more stable and ultimately more stronger. If you do experience some pain and you are drawing the belly button in towards the spine all the time, then it's a mechanism and strategy that you need to change.